Good evening, everybody. Thanks so much for joining us. This, in fact, is going to be the first of a 5-part series that we're going to be doing on lifestyle medicine and how lifestyle medicine can impact our health. So it's going to be really, really exciting. So we're thrilled to have you with us. And tonight we've got the extinguished, no, not extinguished,
Almost
distinguished,
today.
distinguished Dr. Panja with us, and he's going to be taking us through what lifestyle medicine is and basically how it can affect our health. So before we start, Dr. P, I'm going to ask you some yes or no questions. Okay, so I know for a doctor that could be quite difficult, but you can only say yes or no. Are you ready for this? Are you up for it?
I am.
So,
I can't expand on it then.
We can expand later, but for now, just yes or no.
Okay.
So, is it true that you can add years to your life by making changes to your lifestyle?
Absolutely.
All right, that's a good positive start. I like it already.
Yeah.
Fantastic. Question number 2, is it true that up until around about the age of 85, that your health is only 15% reflective of your DNA and the rest is based on the lifestyle choices that you make?
Yeah. Correct, but not only till 85. It works throughout the life history.
Wow.
Genetic is 15%, 85% is lifestyle.
Fantastic. That's brilliant. So this is good news so far. And third question, last question, is it ever too late to start making changes to our lifestyle that can affect our health?
No, it's never too late. If I may just add, there's a professor, Roseanne Kelly from Ireland. She's a professor in lifestyle and lifespan. And she once said this: start early and it's never too late to start. She's written a wonderful book, Age Proof, which some of you might be interested to read. It's about lifestyle medicine. So that was the short answer.
Dr. Panja has been working with the NHS. He is an ambassador for the British Society of Lifestyle Medicine, and he is also a member of the Association for Lifestyle Medicine in the Mediterranean. Dr. Panja, I'm going to hand it over to you, and I'm going to let you take it away.
Okay, so my journey started something like yours in Africa. I was born in Kenya. I moved over to England, where I did human physiology and biochemistry, carried on doing medicine, pediatrics. I dabbled with acupuncture, and then I started working in Malta. So before 2005, I was working in Malta in St. Luke's Hospital, which was the main hospital before Mater Dei. 2005, I went to England, did general practice for 20 years. And before COVID, I decided to come back to Malta and start lifestyle medicine, promoting lifestyle medicine locally. So that's my story, very briefly, my journey in medicine. You might want to ask, what's lifestyle medicine? Yep. It is mainstream medical practice, all evidence-based, and it's practiced by many doctors throughout Europe, United Kingdom, and America. We have the British Society of Lifestyle Medicine, the European Society of Lifestyle Medicine, and American Society of Lifestyle Medicine, all promoting this practice of lifestyle medicine. So you might ask, what is the difference between conventional medicine and lifestyle medicine? The main cause, the main reason lifestyle does is to seek the cause of chronic diseases. What conventional medicine does is to treat symptoms and risk factors. Lifestyle medicine goes upstream to find the main cause of the chronic diseases, which is low-grade chronic inflammation, and it addresses that aspect in the prevention, better management, and even reversal of chronic diseases.
So if I can jump in there very quickly. Sure. So that's basically, we've been dabbling with the fruit on the tree, the problems. Right. So what you're saying is lifestyle medicine, we're going to the root and we're sorting out the root cause. Okay.
Yeah. The root cause is basically low-grade chronic inflammation. Now, chronic inflammation has two parts. The acute part, which is very beneficial, life-saving. It's if you get a sore throat, you get redness, you get pain, there is heat. If you get injured, there's swelling, redness. That's the acute part of inflammation. When that inflammation becomes very chronic, silent, that causes the tissue damage and the subsequent chronic diseases. The chronic diseases I'm talking about: heart problems, diabetes type 2, obesity, cancers, autoimmune diseases, inflammatory processes. So this is what we are talking about: chronic low-grade inflammation leading to chronic diseases, and we try to address that issue in lifestyle medicine. I might want to add a couple of points here. Over the past 100 years, the lifespan, the number of years one lives, has increased, has doubled, in fact, from an average of 40 to 85. And that has been due to conventional medicine, the modern medicine, with antibiotics, vaccination, the diagnostic techniques and surgical techniques. But what I'd like to stress is, even though the lifespan has increased, the health span has not. The number of years one lives in good health, it is estimated that about a third of population by the age of 60 are on one or more medications for chronic diseases. So even though the lifespan has increased, the health span hasn't. And what is the reason? Is it genetic or is it lifestyle? Well, as I mentioned in the earlier part of the presentation, it is 15% genetic and 85% lifestyle habits, healthy habits, which leads to chronic diseases. Modern medicine has done wonders, definitely, in preventing chronic diseases. And as I said, it's very good at acute conditions. We're talking about emergencies, heart attacks, infections, traumas, injuries. But with regards to chronic diseases, I think it has lagged behind a little bit, because they are just treating symptoms and risk factors without going upstream to find the real cause of the chronic diseases.
Some of those things that you mentioned, that are sort of caused by that silent inflammation, the obesity and the high blood pressure, those things that you mentioned seem to be, I don't know if it's just me, but seem to be a lot more prevalent.
Well, chronic diseases have doubled, in fact, over the past 60 years. We didn't have much of this diabetes and heart problems and cholesterol and blood pressure 70, 80 years ago. But this has increased exponentially over the past 80 years. And what is the reason? As I said, it's not genetic. Genetics perhaps 15%, but it's mainly because of unhealthy lifestyles, which is leading to this increase in chronic diseases. So we have to address the real cause. It's like mopping the floor, when you're mopping the floor, but leaving the tap closed. So we have to address the tap and stop mopping the floor, basically. So this is what I'm trying to stress on, that we need to go upstream to find the real cause of chronic diseases and address that. And at the same time, you need to address the present situations. If you have blood pressure, you have to treat that. If you have high sugar in your blood, you have to treat that. But try to go upstream and find the real cause. If you treat health, you don't have to worry about diseases, basically.
What you're saying is it would be foolish not to treat, obviously, the symptom, but then it's about going back now as well to the
going
source,
back
to the cause.
upstream to find the real cause. And that is what lifestyle medicine is. There are 6 pillars of lifestyle medicine. They include nutrition, what one eats and when one eats. It's not just calories. We talk about movement. It's not exercise, moving all the time. Sedentary lifestyle, the importance of sleep, the most important 8 hours of the day, management of stress, chronic low-grade stress, which causes lots of inflammation in the body. Social engagement is very, very important. People don't realize how important it is to engage socially, to avoid painful isolation. We know what happened during COVID time, the fear factor, and the isolation which was during the COVID time. It caused a number of problems, medical problems, with depression, dementia. Of course, avoiding toxins like smoking and alcohol and and environmental pollution, basically. So this is the whole picture about lifestyle medicine in a very brief presentation. In a nutshell, basically, lifestyle medicine is something we need to look upstream to find the real cause and treat that instead of just treating the symptoms and the risk factors. Of course, it's important to treat blood pressure. Of course, it's important to treat the high sugar level or the cholesterol. But at the same time, try to find the reason as to why it is happening and address those issues.
If I may, I'm gonna go back and just summarize all of that for everyone, because some people joined in, and I'm just gonna summarize what we've spoken about, and then I'm gonna open the floor to anybody who would like to ask some questions pertaining to lifestyle medicine and how it can affect your health. So basically, what we've mentioned is that conventional medicine tends to deal with the symptoms, deal with the fruit of what you're facing, whereas lifestyle medicine is going upstream, finding the cause, finding the root, and then delving into that and solving the root and solving the problem, and then, you know, changing the outcome of the fruit. We've also spoken about the fact that low-grade chronic inflammation and acute inflammation. So acute inflammation is that kind of inflammation. If you cut your finger, you know, we get clotting, we get redness, and there's inflammation to start the healing process. So we need some acute inflammation. But then we have the silent low-grade inflammation, which then starts causing tissue damage and starts causing other problems down the line.
Absolutely.
Yeah. Did I get that all in there?
You summarize it very well. So acute inflammation, very beneficial, lifesaver, is the silent chronic inflammation which causes the damage, which leads to tissue damage, which leads to chronic disease.
I'm going to open it up now to anybody who has any questions, and we can discuss them and go over them.
Just to give you a bit of a background, I'm a medical doctor, and I manage a pain clinic where I treat patients with chronic illnesses and advise them on healthy lifestyle and natural ways on how they can improve their quality of life. My question is specific for autoimmune diseases.
Right.
I don't know if you maybe have some experience, or you can maybe guide me on if you have any ideas on how autoimmune diseases come about in children. Would it be something like a tendency that would have been inherited even though there is no family history? Or is it something to do with possible events early in life, including vaccination, for example, or possible illness, you know, that could trigger such a condition to develop?
Absolutely. So I think in children, especially when you mention infections and vaccinations, always a possibility of triggering the process of inflammation. But what we are working on at the moment, there's a group of people of us, we're working on gut restoration. We're looking at dysbiosis of the gut. And I think that is the main problem. If you have a leaky gut syndrome, if your gut health is not very, very healthy, that triggers off the leaky gut syndrome, the inflammation. It stimulates the immune system, and that is how we feel the autoimmunity kicks off. And of course, there are triggering factors as well, as you mentioned quite rightly, the infections and perhaps the vaccinations as well. And the past history is always relevant in children. Of course, yeah, more the adults, the autoimmune diseases, inflammatory conditions, fibromyalgia. We're talking about those conditions where the immune system is hyperexcited, stimulated. So we're working basically on microbiome, doing various tests, the omega-3, omega-6, and seeing the inflammatory status of the individual, and working on that and trying to advise on nutrition, plus if there are any other pillars which might be lacking, sleep, stress, social engagement. We have to take the whole picture into account.
With regards to dysbiosis,
right,
what would be the promoting factors, that one would develop this condition and like a disruption in the microbiome?
It's nutrition.
What could be?
You know very well the
Simply
microbiome.
just from
Yeah.
nutrition.
Yeah, not only nutrition, microbes, the healthy microbes and the unhealthy microbes in the large intestine. That's the largest place where we have the largest microbiome. The second largest is in the mouth. So we have to make sure that we have more of the good microbes and less of the bad microbes. And the factors which control this, number one is nutrition, the prebiotic food, postbiotic supplements, and probiotics. The importance of probiotics, I'm not too sure, because it depends how much of the probiotic reaches the large intestine to influence the microbe situation in the large intestine. But even lack of sleep will affect the microbiome. Stress levels will affect the microbiome. Sedentary lifestyle will affect the microbiome. So you have to keep the happy microbes happy in order to have a healthy gut physiology to prevent leaky gut syndrome and inflammatory diseases and chronic diseases. So, there's a large connection between the gut and the brain, the gut and the heart, the gut and the lung. So we work basically on the microbiome and take it up from there, really.
On the back of that, what about antibiotics and their relationship with the gut microbiome?
When you need antibiotics, you have to take antibiotics. I would recommend definitely not to take antibiotics unnecessarily. And if you do need to take antibiotics, always take them with probiotics as well. Increase your prebiotic foods, take probiotics, and there are postbiotic supplements which you can take as well during the time when you're taking the antibiotic.
Dr. P, thank you so much. It's been a pleasure. I could sit and listen to you for hours, but I know we don't all have hours. We're going to be meeting next week, and we're going to be talking about chronic inflammation, the causes, and specific lifestyle things that we can do that can start having an impact.
Yeah, so it'll be the chronic inflammation will be defined. Two types of chronic inflammation: acute, chronic. The main causes, how we can test to check your inflammatory process in the body, and what to do in order to dampen the inflammation in the body.
We will see you all next week. I'll be posting the event just like I did this time. Invite your friends, invite anyone who you think needs to listen to this, and let's grow healthy, strong, and fit together. And let's create a community of like-minded people that are all striving to create the best versions of themselves. And that's the goal.